Good evening. Thank you guys for joining us tonight. I am here with two pelvic floor physical therapists from St. Luke's right here in Duluth, and they are going to share a little bit about themselves tonight, a little bit about the work that they do, and then let you know when you should go in and see them at St. Luke's. Also, after this chat, there will be a time for questions live with each of them during the event. So feel free to take notes and then have your questions ready for later. I'm going to bring them onto the stage with me here and let them introduce themselves.
Hi, everybody. My name's Amanda Whiting. I'm a pelvic floor physical therapist for St. Luke's, and I am at the Shawamigan Clinic over in Ashland, so a little ways from most of you, I would imagine. I've been treating for about 4 years, and I also treat general orthopedics and pediatrics.
And my name is Emily Johnson. I'm a pelvic floor physical therapist as well for St. Luke's. I float around all of our clinics within Duluth and Superior, but currently I am at our Superior clinic over in Wisconsin across the bridge. I've been treating for about 11 years, and I also treat general orthopedics as well, and I specialize in dry needling.
Oh, I'd like to hear more about that for sure.
I dry needle as well. I forgot to say that. Yeah.
Cool. Well, so in this group of mamas that are watching us right now, they're either pregnant or just delivered or are planning on growing their family. So what would you say a mom needs to look out for or ask their maybe primary care or OB about if they have concerns after giving birth or during pregnancy?
I guess I'll go first, and then Emily, you can catch anything I miss. But I think talking to them about returning to having sex, having intercourse, and if there's any pain with that, I know that's something that's very common, but it's not truly normal, and there is something you can do about it, and we are something you can do about it. We can help you get back to having pain-free sex, pain-free daily activities. If you're having trouble with any urine leakage, constipation, painful bowel movements after delivering or during pregnancy, those are all things that we can work with you to help resolve. Also, if you have a cesarean delivery, we can work with your scar management if that is not healing as well, or if you have a lot of scar tissue built up afterwards, and improving your abdominal muscle strength. Anything else, Emily?
Yeah, in the postpartum period, there's a lot that we can help with. And I know a lot of women out there who are active or want to return to exercise. They always have the question, when can I start running again? Or when can I start doing whatever activity they enjoy? And I know a common thing is they show up to their 6 or 8 week postpartum visit and your OB says, okay, you can exercise now, but they're like, well, what can I do and how do I start? So we can certainly guide you in returning to your activities and your exercise. And then we also help people kind of in their whole process of having a baby. So before baby, when you're pregnant, right after you deliver, and then continuing on in the postpartum time, up to years after you have a baby. So once you have a baby, you're always postpartum. So we can certainly help. And it's nice because those who treat pelvic floor dysfunction, as far as physical therapists, we can also treat general orthopedic things, back pain, knee pain, and it's nice because we see it through the lens of the pelvic floor. So we have we can see a little bit more, and we can treat internal pelvic floor stuff, even though it may manifest as back pain or pelvic pain or hip pain.
Neat. Is it ever too late to have physical therapy for your pelvic floor?
No, Emily, you can speak to your oldest client, but I've had a woman in her 80s that came in with pelvic floor dysfunction, whether it's specifically related to postpartum or something else, but even having like a rectal prolapse, bladder prolapse, things like that. I've had patients in their 80s and have success with it.
Wow.
I agree. Never too late.
That's good to know. My daughter is 5.5, and I've always wondered, like, gee, I should maybe go in and start some, because when I hear, professionals like you two speak about it, I'm like, oh, that could be related to pelvic floor. I never knew.
Mm-hmm.
Awesome. Well, what does dry needling do for the pelvic floor, or how does that benefit a mom?
Yeah, dry needling. So what that is we use a dry needle. So it's not a needle where we inject medication. It's a solid needle, and we can, for lack of a better term, poke sore muscles or trigger points to help alleviate pain. And we do that in non-pelvic floor muscles, and then some of us can certainly do it in pelvic floor muscles as well. A lot of times it's around the hip and the low back or wherever is needed.
Okay. Is that externally then, or internally?
Both.
I mean, obviously it goes in, but both. Okay.
Mm-hmm. Oh, the needles go in through the skin.
Yeah.
Yes.
Yep. But externally, like you start on the outside, or both.
Yeah.
Okay.
Mm-hmm.
Neat. I guess I have seen some women talk about their experiences that they do see a pelvic floor physical therapist, more so outside of the clinic setting, or outside of like a hospital name setting. What would be something that like moms should speak up about if they are getting treated and they're feeling uncomfortable, or if they're questioning, like what is standard for, movements and, what's the word? Like exams, I guess. Like it's a very like small area. It's very personable. What if a mom is uncomfortable? Like, what is something that would be normal to treat, and what would be something that would be, I guess, like, how do I say this? Like how I saw someone in a group ask about like, when I was getting my therapy today, they did this to me. Is that normal, or is that, a little weird? Should I feel uncomfortable about that and report it somewhere? If that makes
Yeah.
sense.
Everything we do, we definitely, or everyone should, any type of therapy that you go to, ask for consent first. Pelvic floor physical therapists are trained to do internal exams, so vaginally and rectally. That is something that some of us do on the initial evaluation, and some people wait until the second or third visit. Personally, I wait until the person's comfortable. Like if somebody is nervous or anxious about it, I'll spend time going over what it is, why we're doing it, what that experience will be like, and wait until they say they're ready. There's plenty we can do externally until women are ready for an internal exam, and some women are never ready for that. So our role is to help women be comfortable and treat them the best that we can with what we have.
That's great to know. The conversation that I was referring to was not even local to Duluth at all. So, but it got my mind going like, oh, I never even thought about that situation. And so I think one of the important pieces with all of your healthcare needs would be the open communication with whoever is treating you or with your provider.
Yeah, I'd say that first initial evaluation for pelvic floor, we certainly have a long conversation about what to expect, and that we do whatever you feel comfortable with. And we explain why we recommend maybe an internal vaginal or rectal assessment. And like Amanda said, some people are okay with it right away, and some people never want an internal. And the difference is, we, compared to maybe your physician or OBGYN, we don't use a speculum. It's just all fingers, and we make sure that it's comfortable and not painful, because sometimes people come to us because it hurts to have intercourse or to insert tampons or etc. So we don't want people to feel like we're going to be putting medical equipment in them. It should be safe and comfortable.
Yeah. And, that's something where I've noticed a lot of people who come in and they're like, I heard you do this. I don't want that. And I say, that's okay. And I explain, what it actually looks like. And a lot of times hearing it from a professional's view and the purpose of doing it, like, why would you do that to me, helps people realize that, oh, that actually makes sense why you would do that. Let's go ahead and do it. But I think a lot of it comes from a place of not fully understanding, like, why would my physical therapist do a vaginal exam? That's weird. But once they actually understand how it's going to help them get better, I would say I've probably only ever had one person in my 4 years, which isn't that long, I realized, but maybe only one person that didn't want an exam the whole time. So I think most people start to get a little bit more comfortable with it.
That makes sense. Great. Well, do moms need a referral from their primary care to seek physical therapy?
So how do we answer that? For St. Luke's, St. Luke's Hospital requires a physician's referral. However, in the state of Minnesota, physical therapists have direct access, meaning they don't need a physician's referral right away to come see a therapist. However, St. Luke's does.
Okay.
Yeah, and so the Wisconsin is the same way. We're also direct access, and the reason St. Luke's has everyone get a referral is just for simplicity, because most insurances are unfortunately behind the times, and they require you to have a referral. So St. Luke's has just kind of said, everyone just have a referral, keep our bases covered. Most people, it's pretty easy if you have an established OBGYN or primary care provider, just to call them and say, hey, I would like to go to physical therapy. Can you please send a referral to St. Luke's in Duluth or Chequamegon Clinic, wherever. And a lot of times they'll just send one over for you pretty easily.
Yeah, that's great. I know that's pretty standard, pretty common. Even like seeing a dermatologist is the same. It's not hard to do it, but to just cover all the bases, just need the referral. Yeah. Awesome. Well, do you have anything else you would like to share before we head into the personal chat rooms with the question and answer sessions?
I don't think so. I hope that was a good introduction and kind of spark some questions, because I know a lot of people have specific questions related to what's going on with them. So we encourage you to ask whatever questions you feel comfortable, and you'd be surprised how much physical therapy can help you related to pregnancy, postpartum, and even trying to get pregnant. So please ask us.
Yeah,
Great. I
agree with that.
Yes. Well, thank you so much for taking the time to be here with all of us. And I hope we have some great questions for you.
Thank you.
Thank you. Bye.